Hello and welcome to this introductory class on family medicine, on the rotation and its assessment from the RCSI Perdana Department of Family Medicine. I'm Professor Anthony Cummins. This is an overview of the video as it will progress through these various elements. The first thing to point out is that week 1 is bedeviled with 2 national holidays, and because of this there'll be no teaching on the 12th and 16th. So we have to cut our teaching down into 3 days. And that's quite difficult, hence these video presentations. On the Monday evening, I have set your pre-course MCQs to begin at 7:30. It lasts 30 minutes. There are 20 MCQs with single best answer format. On the Tuesday morning, we will run through this introductory class again. But I felt it was important to make the video so that you can refer back to it subsequently. We will focus also within this video on how you are assessed. Following your introduction and assessment class, you'll have 2 classes on evidence-based medicine. The first run by myself on Introduction to PICO and a historical introduction to evidence-based medicine. The second one being Searching for the Evidence, which we will present collaboratively, myself and Tuan Hasbullah, the Chief Librarian. In the afternoon, you'll attend your ATP session, your Augmented Tutor Teaching Practice. More about that later. On the Wednesday all day, you will be at PU, having a session on video consultations in the morning and clinical skills updates in the afternoon. On Thursday, half of you will attend Hospice Malaysia for your palliative care session. For the next 5 weeks, weeks 2 to 6, you will be in your clinical postings, including 4 clinic kesehatan settings and 1 private GP. So in each of those weeks, you will go through a standard format. And I'll touch on that in more detail throughout this video. On week 7, you return to base, mainly GSH, but also at the Serdang campus. We'll have an initial review, followed by your presentation of an ethical challenge, and then a final review on evidence-based medicine. You'll have a repeat of your video consultations on Tuesday. You'll have on Wednesday 2 sessions of presenting cases, 1 to the ATP and 1 to palliative care staff at Hospice Malaysia, and then 2 more days for revision and uploading of assignments for your portfolio. These are the 2 groups, one group divided into 2, E1 and E2. Your learning outcomes are here. Looks like quite a big list, but effectively, we want you to become a good communicator, able to take a competent history and examine patients, and to perform clinical procedures with ease. You should be able to integrate all of this to formulate a differential diagnosis, but including a focus on the patient's own illness experience and not just the disease or disorder model of doctors. You should be able to formulate a management plan, including drug and non-drug options with a focus on lifestyle changes. You should also be able to incorporate all of this with an evidence-based approach, underpinned by an ethical and legal framework, and at all times being professional and reflective in your dealings with patients. You should also be able to discuss the role of primary medical care systems within healthcare systems generally. This varies from country to country, and notably between Ireland and Malaysia, there's quite a difference in the role of general practitioners in the healthcare economy. Let's look at the family medicine Moodle pages. There's a course administration section to begin with. This has a very important welcome letter. Please read this. We also have the Family Medicine Forum, which is an important communication between faculty and students. I know we have WhatsApp and email, but this is actually quite a useful forum. And then there's a list of student groups, attendance timetables, and so forth. The course curriculum is a whole range of topics that are relevant to family medicine. And then there are additional resources, such as links to online videos, about patient experiences, about clinical skills, and so forth. There's also a link through to the Oxford Handbook, 4th edition. Also on the same screen is an outline of the portfolio of assignments which you must upload. They all have model answers and templates for completing your assignment and uploading. Before you go to your clinical postings, be aware you should have read the core curriculum. There'll be some YouTube top videos on clinical topics. You should also check these before you go, and be prepared. Check the timetables in the group list. Don't end up in the wrong place. Check, especially if you're car sharing, make sure somebody's got a smartphone with Waze or Google Maps. You must pay attention to confidentiality at all times and behave professionally at all times. You must arrive on time. Arrive early. Don't leave early. And certainly don't disappear on Friday afternoon. This is monitored. You must dress appropriately. Now, of each of the clinical postings weeks, you will come back to GSH on Wednesday afternoon for a review. This is an open forum, but if there are no particular topics to discuss or aspects about assignments, then I will develop topics to explore for you. On the Friday morning, you will present cases. This is based on an OSCE station called the Clinical Encounter Station. It will be, as in typical OSCE, a 6-minute station, and there will be immediate feedback from myself and your fellow students. Palliative care teaching begins in week 1, where there is a class on palliative care, and also half of you will attend on Thursday the 15th of September, Hospice Malaysia. In week 2, the other half will attend. In week 7, on Wednesday, October 26th, both halves of the groups will get together and you will present individually a palliative care case to myself and the hospice staff. This is subsequently uploaded to Moodle. Now, what are these augmented teaching practices? Well, these are GPs who particularly focus on communication skills and consultation skills, and you will see them on 2 occasions in your 7-week rotation, week 1 and week 7. On your first visit, you will be introduced to a patient with a chronic disease. You will be in a small group of 2 or 3 students, and you will have an introduction by the tutor, who will then leave you with the patient, and you will discuss various aspects of this patient's story, and these are outlined here. Subsequently, at the end of that session, you will return to the tutor. The patient may or may not be present, depending on circumstances, and you will present your findings. In week 7, you return to the same tutor, the same students, but you present 2 cases of your own that you have identified during your 5 weeks of clinical postings. There's a template for presenting this. Now, go easy on the slides, less is more. Just talk through it. It helps to develop your presentation skills. These are ATP tutors, Prakash Gurusamy, Kohila Devan, Sheila Selva, and Emma Zulkifli, with the students who are attached to each practice. Let's look at your overall clinical postings. We've already covered this. These are your clinical postings. So you can see in week 1, half of you are split into 2 half groups. Half of you attend KKCheras and then on to private GPs, and then you swap over for the next week. For the week after that, half of you are in HKL OPD and half are in KK Sentul, and then you swap again. And for the final 5th week of clinical postings, you are split between Stapak and KKCheras. These are your GP tutors, Kohila Devan, Patrick Justin Lawrence, Emma Zulkifli, and Prakash Gurusamy. You can see we've given here also their hand phone numbers. Please don't use these except in an emergency. Don't contact them routinely on their hand phone. They will not appreciate it. Similarly, these are your Clinic Kesihatan tutors, Sheila Selva at Cheras, Rohaya Ismail at Sentul, and Zainal Fitri at Stapak. Again, don't use their handphones unless necessary. In HKL OPD, there are several tutors, but this is the main clinical director, Dr. Raj Anantha Daniel, more informally known as Dr. Daniel. So this is your timetable. Week 1, we've only got 3 days, and this is the outline here. So we will cover the key features questions in some detail during that. We'll have 2 sessions on evidence-based medicine, and we will manage to cover the introductory session and the assessment guidelines. On the Wednesday, you're at PU doing videos and consultation skills. That's in the afternoon, the videos in the morning. We will have a session on multimorbidity in between. On the Thursday, half of you are in palliative care, and the other half of you will have class teaching at Grand Seasons, morning and afternoon. We'll cover these 4 in the morning, prescribing, medication review, professionalism and reflection. And then in the afternoon we'll cover ethical challenges in palliative care. On Tuesday afternoon you're at your ATP practice, and Wednesday afternoon you're at PU doing your clinical skills updates. And these are a series of OSCE format updates which will be very helpful. Certainly previous students have consistently found them exceedingly helpful. So the following week you start your clinical postings. Half of you are at GPs that week, and the other half are with the Clinica Sihatan. Another thing to point out here is the health promotion class since last year has been presented by students. We all found the original didactic class extremely boring, so we decided to flip it, and you have a clinical scenario here from which you will fashion a collaborative video with role playing, etc. And you will also incorporate how motivational interviewing can be used to aid changes in behavior and lifestyle. This has proved to be a very interesting and enjoyable class. The video normally lasts only for about 15 minutes, so we will use the remainder of the time to focus on motivational interviewing and how we can use this to facilitate behavior change. Also, in each of these clinical weeks, you will have a midweek review and then a case presentation on Friday morning. So the following week, you're swapped over. So Tiveshini's group will be in the KK Chiras, whereas Vinod's group will be with individual GPs. The next week is the same except for different locations, Sentul and HKL OPD, and with the addition of dermatology. This is provided by Dr. Leon King Fon, who's a pediatric dermatologist at HKL. And unfortunately, he's very busy. We have to abide by the times he's available to do this. So it means that those of you who are at HKL OPD, well, it's just across the road, you come over at 11 AM for this class. And those of you at KK Sentul, which isn't too far away, you also come back for that class. You can return to both of these locations in the afternoon. Again, the following week, just swap over. And in the final clinical posting week, you'll be at either KK Cheras or KK Stapa. In your final week entirely of the rotation, the week beginning Monday 24th of October, you're back in campus at GSH on the Monday, where we'll have an overall review of the rotation. We will also have you presenting your individual ethical challenges that you encountered during your 5 weeks of clinical postings. We'll have a summary final class on evidence-based medicine. You have the afternoon free for revision and uploading. On Tuesday, you have your repeat video consultations at Block B in PU. And you have the afternoon again free for revision and uploading. On Wednesday, it's a day of presentations in the morning to an ATP tutor, and in the afternoon to palliative care or hospice Malaysia. Thursday and Friday again are free for revision and uploading. Now, bear in mind this is a provisional timetable and may be subject to change depending on circumstances. Let's look at the video consultation skills and the clinical skills update. The video skills are weeks 1 and 7 in Block B. You will individually consult the patient with your role as an urban GP. You'll be given some information on a sheet to read before this, and then you consult the patient. This is all videoed, and after all the videos are completed, we will review them all and provide feedback from yourselves, myself, and the patient. And this again is repeated in week 7. Clinical skilled updates are provided in week 1 only. We began this last year because students coming in from intermediate cycle over the summer, their clinical skills had atrophied, and we felt it would be important to provide you with an update. So these are OSCE format. We assess your examination skills and your practical procedures. It's held at the clinical skills unit, and it's followed by verbal and written feedback. You should keep those sheets for practicing and improving. An important point to say here that students who do this, you can tell when they do their actual end of year OSCE, they just float through it, no hesitation. Those who haven't done this are very hesitant and the examiners deduct marks because they don't seem to know what they're doing. It's all about practice and repeat, repeat, repeat. So use the sheets and practice with a colleague throughout the year. The key features questions is a new development since last year. It replaces the data interpretation paper. It helps you to focus on prioritizing options for management of patients. This is what it's all about. What is the most appropriate treatment for this patient at this time? In the past, you could provide the appropriate answers, but also some sometimes crazily incorrect answers, but these were not penalized. From now on, they will be. In the KFQs, marks will be deducted if you cannot prioritize and you include too many answers, or if you fail to identify the correct ones. This is important in helping you to prioritize choices, not just for exams, but for your future career as a doctor. It's an important attribute of a doctor, especially working in acute specialties, to be able to prioritize what's the most important in a differential diagnosis or the most important management, for example. How you assess. This is the bit you all want to hear about. Okay, there are two ways of assessing you. One is by continuous assessment, by submission of portfolio assignments at the end of your rotation in week 7. This is worth 30% of your marks, so don't throw them away. You should be able to garner virtually all of those marks with good assignments. And the end of year is worth 70%. That's divided to 30% for OSCE, 20% for MCQ, and 20% also for the KFQ. Now, a word of warning. The clinical OSCE is a must pass. Fail the OSCE and you fail the entire thing. You cannot compensate for a poor OSCE with good MCQ and KFQ results. Cannot. If you arrive late for the OSCE and this has happened, you will be debarred. If you're debarred, you failed. If you failed the OSCE, you failed everything. You have to resit. Your marks are then capped. You cannot achieve an honors grade. You must be very clear about this at the outset. These are the assignments for your end of rotation assessment, and these are each receives a mark of 6%. In total, we're 30%. And these are not marked, but they're very important formative assessments. Because they're not marked, please don't devalue them and think they're unimportant. If you don't submit these or they're late, then you will not receive a mark. Your portfolio is inadmissible and you may be ineligible to sit the summer assessment. This is very clearly outlined in the marks and standards that come from RCSI Dublin. If you don't submit all assignments, you're not eligible. This is the clinical tutor assessment sheet, which your tutor will mark at the end of each of your week's postings. Please produce this sheet at the beginning of the week on the Monday so that they know what they're going to assess. They'll be assessing these 5 or 6 parameters: clinical knowledge skills, communication skills, history taking, interest and motivation, reliability and timekeeping, and they'll grade you from poor to excellent. They can also add in free texts here. Similarly, you will have a record of clinical activity of all the clinical examination and clinical skills that you have mastered during these 5 weeks. So each time you attend the clinic, you tick when you have done it, and your tutor will sign at the bottom and chop it to confirm that you've done it. Similarly, with your ATP assessment sheet in week 7 for your second visit, they will mark you, grade you on these things, and they will sign and chop. What do we expect of you? We expect you to turn up at lectures. We expect you to turn up at all your clinical postings, because if you don't do this, you'll be ineligible to sit your end of year assessment. Missed days have to be made up, but you may still be ineligible to sit. Even if you provide medical certificates for genuine illness, if you are off for more than 3 days, you will be ineligible to sit the summer assessment. The absence from classes or from clinical postings is not allowed for family holidays, weddings, or just because lab. You're not allowed to have mobile phones in class unless we specifically want you to search for evidence in an evidence-based medicine class, for example. But generally speaking, they will all be surrendered at the start of class and they'll be available at the end. This is not negotiable. There is a dress code. You should abide by that. Now, I must point out the most recent updates on the RCSI disciplinary procedure. Breaches of professional behaviour by students are taken seriously, and in fact worldwide this is becoming increasingly serious and being met with increasingly stiff penalties. ultimately leading to potential expulsion from medical school. So our disciplinary procedure is as follows. If you are absent from class or late in arriving at class, you'll get a formal verbal warning right there. This will be followed by a written warning. You'll be advised about improvements that are required and the timescale in which you should achieve those improvements. If there should be no improvement in your behavior following the first episode, or if there should be a further episode, then a second stage warning is given. This is an entirely written warning, there's no verbal warning, and again you'll be given a timescale. There is a potential third stage warning if there's a further issue and no improvement, but this may lead to expulsion from medical school. Your evaluation is very important to us. There are two ways you can do this. You do it informally to us during the rotation, but also at the end of rotation, you will complete an online anonymized, this is wholly anonymized evaluation. It's really important to do this because it helps us to improve the rotation for the next group or for the next year. And each year we have improved in our rotation thanks to your evaluation. So for example, the consultation videos, the clinical skills updates, the midweek review, the Friday morning case presentations, these all came from students' suggestions. What about the feedback we get from students? Usually it's quite positive. There are occasionally some negative ones, but generally speaking it's very positive, and I think the students value the family medicine rotation. So you know what to expect of, what's expected of you. You know when you discover that we are structured and organized. We respond to your queries and concerns quickly. We get a lot of responsibility in the practices and in the clinic kesihatan, and you get taught a lot regarding patient care and management. There's a lot of feeling that the clinic kesihatan offer more structured teaching than private GPs. And so your teaching exposure is largely with clinic kesihatan. Now finally, if you encounter any problems with tutors or anything to do with your rotation, please let us know, but let us know early. You can send us by email or WhatsApp. We can't act unless you tell us in time. It's really important you don't wait until you're finishing a clinical posting to let us know that this hasn't gone well. If it's not going well, bring it up. That's part of the purpose of having our Wednesday afternoon sessions. And please bring it up in the group. Don't be embarrassed to bring it up, because if you bring it up, I'm sure you'll find that others are having similar experiences but felt equally embarrassed to bring it up. So if in doubt, shout it out. Thank you.